Welcome to our frequently asked questions about oral sleep appliances. My goal here is to just help answer some of those questions that maybe the general questions that most people have, and use that then as something that you can utilize to help yourself determine, is this something that maybe I should explore more or not? One of the more common questions is, what is it? What's an appliance? What's it look like? And what's it do? So I have a couple of the more common appliances that we use. This one, if you happen to have Medicare, it is one of the required appliances for Medicare. As you can see, it has hinges and it's hooked together. That's one of the things that Medicare does require, is that it's an appliance that's hooked together, as opposed to one of our other more common appliances, which comes apart and they aren't hooked together. So the appliances. Now, how do they work? Many of you have had a CPR class. One of the things that they'll teach you in a CPR class is to lift the chin and tilt the neck. And what that does is it helps open the airway. So the oral appliances, their mechanism of action is pulling the lower jaw forward, which pulls the tongue forward, which helps to open up the airway. And that's how we see the results, is that increased airflow because of the airway that has been opened up. Cut. Will it work for me is another common question. No real easy definitive answer to that question, because it does depend on the severity of your sleep apnea. It depends on teeth. Do you have adequate number of teeth to help hold and retain the appliances into place or not? And are you claustrophobic? Those sorts of things will help kind of determine whether it will work for you or not. But in most circumstances, the answer is yes, it can work. The more severe your sleep apnea is, maybe it's not quite as effective as alternatives like the CPAP machine may be, or some of the other therapies. But in most circumstances, yes, it will work for you. The process and the time frame, again, depends a little bit on insurance, no insurance, some of those variables that play into the fact. But let's consider the fact that maybe you do have insurance. So we will need to gather some information from your sleep physician, from your general physician, that we need to utilize to help get the insurance authorization, which is really the first step. Is that in most circumstances we need a prior authorization from your insurance company in order to do the appliance. That usually takes 4 weeks or so, 6 weeks, depending on the insurance company, to get those prior authorizations back. Once we receive that, then we're able to take the impressions and send it off to the laboratory that makes the sleep appliance for us. And it takes our laboratory about 3 weeks or so to get the completed appliance back to us. Once the appliance is back, then we'll go through a series of adjustments to make sure that we're controlling the sleep apnea that's going on. And probably 3 months or so down the road, we'll repeat an at-home sleep test just to make sure in most circumstances that we're controlling the sleep apnea. Side effects. Typically there are 4 major side effects that people will talk about. 2 of the side effects are very easily controlled by you and what you do before you put the appliance in at night. The bacteria that contribute or cause cavities and gum disease are bacteria that love it to be dark, love it to be moist, and love it to not have a lot of oxygen. So if you don't clean your teeth before the appliance goes into place, we're creating the ideal conditions for those disease processes to happen. So easily controlled by making sure that you thoroughly clean your mouth, your teeth, and everything before you put the appliance into place. Another side effect that people will talk about is some minor tooth movements. We'll see maybe some rotation, little rotation here and there, maybe a little opening of the space in between the teeth here and there. The appliances do fit very much like an orthodontic retainer, so we don't expect there to be a lot. But because we are, yes, holding that lower jaw forward, we are applying some torque to the appliances, and occasionally as a result of that, we will see some minor movement going on. Now, the one side effect that gets the most play, the most talk, is contributing to TMJ problems. Now, one thing you have to realize is that most of the appliances that we use actually got a little bit of their start from treating some people with TMJ problems. And anecdotally, we found that, hey, people are starting to sleep better. So we know that they can actually help problems in some circumstances. But it is an area that does get a lot of play. And we will have some exercises, some things that you do in the morning when you take the appliance out to make sure that we get those muscles to relax and get that jaw to go back into its normal position. And that's probably the most important thing that we're going to give you from a standpoint of instructions, is making sure that you are doing that to get those muscles and that jaw back into its normal position. And then we can control, in most of those circumstances, any problems that you're going to have with your joint. Will my insurance cover it? Is another common question that comes up. Candidly, this is probably the million-dollar question. Not only whether they're going to cover it, but at how much they're going to cover it. Now, in most circumstances, again, we can say yes. Your insurance company is going to look at, are you using a CPAP now? And if you are you effectively using that CPAP? If you are, then in many circumstances, they're not going to cover an oral appliance. We kind of have to show intolerance to the CPAP in most circumstances to get coverage for the oral appliance. Now, if you have not had any treatment previously, then in most circumstances, we can fill out an affidavit stating the intolerance to the CPAP machine, and oftentimes jump that hurdle of having to use a CPAP machine. Now, the next question is, how much is my insurance going to cover and my insurance going to pay? That is really an unknown. It varies from company to company and even varies from policy to policy. We try our best to give a good guess of what we feel that your insurance is going to cover, so that you're comfortable and we're comfortable knowing what your investment is going to be. One of the things to consider in that, though, is what's the value of 5 to 7 years of your life? That is what most studies will show you will add to your lifespan with the proper treatment of sleep apnea. So have to keep that at least in the back of your mind of what that value is to you. Now, we're going to submit to your insurance over $3,000 as our base fee. And then based on your insurance company and what they're going to cover, we can help you guesstimate what your patient portion will be. Now, we do have a number of individuals who have maybe higher deductibles or do not want to go through insurance, or perhaps even don't have sleep apnea of a high enough level that the insurance will cover it, or that medicine even considers that it's sleep apnea, i.e. you're snoring at night, but you actually don't have any sleep apnea. In those circumstances, we do have a couple of different fees that we can utilize to help make that more comfortable for you, particularly if we're not going to be submitting it to your insurance company.